Great, Pemma, and some really good thoughts there. There is one question that's in the chat box there, and it actually I'm going to try to weave it into my next question. I'm going to ask Lawrence and Paula to respond first to this one. And Pemma, you were taking us there. The question is, what values kind of came to life? Paula, you said you weren't ready in Peel. Not sure how we could have been ready, but those were your words there. But how did these values come to life or remain front and center, or kind of how you pushed them front and center during the COVID-19 pandemic? And the question is, how are the values measured? So you did talk a little bit about some of the data collection. And Pemma's hinted both in her just recent comments, but earlier around those tensions. And I think there had to be tensions. I mean, those tensions playing out in and continue to play out in society. So did those values come to life or remain in the center? Was there an evolution? And what were those tensions and maybe some of the measurements? So Paula, Lawrence?
Paula, you want to go first?
Sure. So I think, in terms of what values were really coming to life first, would have been humility, I think, is first to come to mind. Peel Public Health, we are known for things like evidence-informed decision making, and some of our work, to advance some of research and items like that. And I think what we really learned from the start of the pandemic is, in some ways, Peel was not well positioned to do some of the very on the ground work with communities and to understand what's happening within our extremely diverse community base. And we really acknowledge the leadership, knowledge, and strength of our community agencies. We were able to identify fairly quickly that is really where the knowledge, expertise, and the ability to reach our community members lie. So I think taking a step back from some of our known leadership, and I still think that Peel is a leader, but faced in a pandemic of this magnitude, we really had to step back and look and see where are we best positioned to do this work, and who from our community has those knowledge and expertise, and really trying to be humble and showing humility in that sense.
And I would just add to that, Paula, that in addition to the fact that it was all new for us in terms of, well, not all new, but iterated new based on our new strategic priority, and really just setting out on this work. I think it can't be understated the importance of change within an organization and how that also influences things. As many of you may know, I assumed the role of Medical Officer of Health on an interim basis on March 14th, 2020. And to this day, I really rue the fact that I did. No, I'm just kidding. But I think in essence, being a new Medical Officer of Health, not having had necessarily all of those connections and leadership and community engagement really meant that in addition to building from the ground up in respect of our pandemic response, we were also building from the ground up with new partnerships, with a new leader, with many other new leaders. There were a number of senior leaders who had left, and I imagine this was the same for many public health agencies in Ontario in 2019 with the announcement of modernization and restructuring. So trying to find our way through both the new strategic priority and how that outlined, but also just a new leadership structure that was ultimately tasked with engaging the community and having to do so rapidly and in good fashion, and really learning things on the fly, added to what was a very interesting journey in this space for us at Peel.
Thanks, Kate and Lawrence, for those responses. So in Niagara, and the question there, you can see it in the chat box, is Eric Robart is asking about your region being on the border. And I know you were going to answer from that perspective in terms of those values that came front and center. So over to you, Kate or Mustafa, please.
Yeah, I don't totally follow the border question. So if Eric wants to give a bit more detail, that might help us to know how we might respond to that. In general, in Niagara, and I think in public health as a whole, we think of people as people, and we don't particularly care who they are or where they're from. So, whoever happens to be in Niagara region is a person, we're going to care for them the same way as anybody else. I think a lot of what Paula and Lawrence talked about really applies to us here as well. One of the reasons why we have the National Collaborating Center for Determinants of Health, and we're doing all these efforts to improve health equity and having a webinar here is we know we're not doing well enough. We know there's much farther to go, and it's obviously difficult and complicated, and we're all trying to figure that out. And so at some level, I don't think any of us are entirely ready for it. Some of the ways that played out here in Niagara is, we have a sizable population of migrant workers who work in our agricultural sector. And that was a location where we had outbreaks. That was a location that wasn't well served by healthcare. They weren't people who had good access to going out and being tested. And so that became an area where we had to do a lot of work. And, I think the value in our strategic plan about meeting people where they are was really central to this. So we had to figure out, who is this population? Where are they? What are their needs? They generally don't speak English. So we had to find ways to make sure we had translators in. We actually had a couple of public health staff who were Spanish speaking, and we actually had them redeployed over to working with us on some of these outbreaks, understanding their needs for testing and finding a way to bring testing out to them rather than having them find their way over to an assessment center, making sure we did enhanced work to go out and inspect their housing to make sure we mitigated the risks of COVID spread as much as possible. We actually had an order we put in place for our agricultural sector so that we could raise the standards of infection control across all of the areas where migrant workers work. And that was, one example of doing that. Another example, I think, was in long-term care homes. And I think much has been known about long-term care homes already. But one observation we found is that really the day-to-day frontline workers within a long-term care home are really personal support workers, PSWs. And we had a sizable PSW population who are not actually Canadian-born. They're actually foreign-born people who've come and moved here. Often, you have 6, 8 of them living together, making only a small income, really pooling their resources to get by. And we found that sometimes you'd have spread of outbreaks and they're doing everything right in the long-term care home. And they probably were. And what was happening is, unfortunately, when they went home, they're now living in a communal environment together. And so starting to think through how do we address that, recognizing this is a situation they're in, and how do we meet them in that situation and find ways to mitigate the risk, help people who maybe need to isolate get out of that kind of housing environment and the like. And I think, one just final thought I have of, some of the tensions that we felt. And, I think this is actually a conversation that we've been having with Peel Region lately is, a lot of what we've done in, we recognize in public health, just to take a step back, that health impacts disproportionately impact those who have greater health inequities. We know that. Uptake of treatments, preventive measures, vaccinations is going to be disproportionately lower in people with health inequities. And a lot of what we are doing sometimes to manage the pandemic in maybe post vaccinations by having policies, maybe actually hurts these people with health inequities, while at the same time perhaps protecting them. And there's unfortunately a tension there. So, we put lots and lots of economic restrictions to try and control the pandemic. And of course, that's going to prevent spread of infections and perhaps disproportionately protect some of these people who are low income. But it also meant a lot of those people with low income lost their jobs. And so they were kind of hurt either the approach of policy we took. With vaccinations, people who are health inequities, they have lower vaccine uptake. We're now thinking about policies to get the vaccine uptake higher so we can lower the spread of infections, which hopefully will protect them. But it's perhaps also marginalizing some of these marginalized populations even more because they're the ones who aren't vaccinated yet and are going to be the most impacted by some of these policies in a punitive way. And I think that's one of the big tensions that's really come to mind of how our society works. And I think it's really reflective of some of the structural inequities in our society. And hopefully one of the big lessons we take from the pandemic is to focus on those and try to address those over the long term.
Thank you. And Paula? No, I'm sorry, Kate?
Yeah, no worries.
Yeah,
that was Dr. Hirji touched on a few things I was going to as well. The migrant farm worker one in Niagara was a big priority population. And so a working group was actually that meets this afternoon was established to kind of help respond and support that population moving forward, even after the pandemic, which is great. So in a strange way, you know, a lot of inequities existed in prior to the pandemic, and the pandemic just shines a light on it. And almost it made me think of something Pemma mentioned around the tensions of readiness for change. It almost sparked a readiness for change because now it's right in front of us. So another example is here at the region, we also launched interpretation services. So over the phone interpretation, and that I think was pushed forward even faster than it would have without the pandemic because of this readiness for change. So that was, I don't even want to say it's a positive, but it is a slight silver lining of kind of the urgency that's come from the pandemic, which has been a positive with hopefully moving this forward in a sustainable way.
Thanks, Kate. So that notion of complexity, I think is present in both of your stories. And I think Pemma said earlier about us not really being, and which I think it's true, not really being trained or educated as practitioners and decision makers, you know, to really take a look at it from that complexity perspective. And then it really was a harsh light, wasn't it, Kate? It didn't just shine a light, it shone a harsh light on the inequities that had already existed and that have been made larger as a result of COVID-19 and the pandemic.